Welcome to We're at the Age from Voice St. Louis.
We're at the age we can't do it all anymore. In today's episode, we really wanted to get into the struggles of the sandwich generation. If you got younger kids and older parents, you're just dealing with it all. Vicki Davis joins us to talk about different options for in-home care. These services are not just for older adults. Give yourself some more options by finding out how in-home care can help you.
Today, I've had a lot on my plate, a lot of plates spinning, a lot of older adults to care for. So today we're talking about home care and home health care and all of those different in-home care options that we have. And I was thinking back to about a year ago, maybe 2 years ago now, when my uncle needed a little bit more help. He had fallen, he was in the hospital, then he went to rehab, and then he went to a nursing home for a while. And then we said, oof, this isn't working. Let's bring him home and see what we can do. Because he didn't need a ton of care all of the time, so he didn't really need to be in a nursing home. But he definitely couldn't do it all by himself. And my mom and I could not do it all by ourselves anymore. So we started looking at in-home care options. And let me tell you, it is a huge landscape of a lot of different options, a lot of different things. I've been working in this business for 5 years now and still was coming across things. I was like, I had no idea that this was available. So I'm really glad that we've got Vicki Davis here today to tell us a little bit more about the home care, home health care landscape and help us figure out exactly what folks need when they realize, somebody that I love needs more help, but I can't do it all anymore. So welcome, Vicki.
Thank you. I'm excited to be here. Thanks for having me.
Absolutely.
Yeah.
So our first question that we're trying to start people out on is, who are you caring for?
Yes. So personally, I'm caring for a 6 and an 8-year-old. So that's a really good time.
Yeah.
It's very fun. But yeah, being a working parent is challenging in and of itself. And they're right at that cusp of, starting to become more independent and independent with some things, but still needing a lot of care and support. So, yeah.
And a lot of rides, too, at that age.
A lot of Uber driving in the evenings for free. Yes.
So you're here to talk to us a little bit about home care. And before we kind of jump into it, I know that there's home care, there's home health care. What are the difference, and are there other things we need to be thinking about?
Sure. Yeah. So the biggest thing when I talk to people and I try to explain it the best is home care is like an umbrella term. So if you think of home care as the umbrella, and under that umbrella is home health and then home care or private duty. So it's all really in the terminology, and a lot of people use the term home care, and it's really important to clarify when someone recommends home care, what exactly are they recommending when they are saying home care? So home health is more of your medical care. It's something that you receive on a short-term basis, covered through Medicare or your insurance, requires a physician order. That's where you have your professional discipline focus, your PT, your OT, your speech, maybe an RN coming out to provide that in-home care support, just typically after an acute episode. And then the private duty in-home care is more of your I could say like a la carte support. So that's what you are really driving what that care looks like, how many hours of support that you're getting. They're not certified licensed necessarily, or they don't have to be. So that could be, a variety of support under that private home care space.
Okay. So we're talking about with private duty, maybe they can do some meals for a person?
Oh, yeah.
Okay.
Yep. Meal prep, even help feed someone if necessary. So, there's a wide range of support that's available within that scope.
So we've got a lot of exciting things happening here at Voice. And one of the things that we're most excited about right now is our first ever fashion show. So Timeless Elegance, a vintage Vogue event, is going to be a fashion show all for older adults and people with disabilities. It's going to be unique, it's going to be fashionable, and we hope that you can be a part of it. We're going to have brunch, swag bags, silent auction, live auction, and of course, lots of models. Right now, we're looking for help with sponsorships for the event, silent auctions, and outfits for our models to wear. So you can get involved today by going to voicestl.org/fashion show.
So one thing that I realized when I was researching this that I found interesting is that in-home care is not necessarily just for older adults. Like sometimes younger people can utilize it. Like what are some situations where a younger person might bring in in-home care?
Yeah, I mean, I think probably the number one thing is someone with a disability. So, it might be that, you have an older set of parents caring for an adult child with a disability, and those aging parents are now, having some physical limitations, or maybe they're unable to drive anymore. And as we all know, caregiving is very taxing on someone, not just physically, but emotionally. So that is another area where a lot of people utilize that sort of support.
And this kind of leads me to another question is, so when you hear a lot of folks who are caring for somebody who has Alzheimer's, or maybe a young child who is on the autism spectrum, you hear a lot of respite services. Do those fall often under this category as well? Or is that something completely different that we shouldn't even be talking about?
Well, respite care, so typically respite can either be done on a private pay basis. So you can pay to send your loved one somewhere that can meet their needs and take care of them outside of your home, essentially. Or there are programs like hospice companies can pay for a 5-day respite every benefit period in a community. So the respite is really used to relieve the caregiver, essentially.
Okay, great. So we've been talking a little bit about in-home providers. What are some things that they can do, and what are some things that they can't do?
So it all depends on the provider. So it depends how they're being funded. So if you're looking at something on a home health that's being funded by your insurance, there's going to be things that are limited to, again, that licensed staff. So that physical therapist, occupational therapist, the RN. When you look at the private duty home care side, you have limitations because they are not medical. They're not allowed to administer medications or to administer the insulin. So, you kind of hit a wall with the medical support. So they can help up to a certain point. And then beyond that point, it would either require, paying for a private nurse or doing education with the family. So then the family could help administer those medications, things like that.
Okay. Now, could they remind somebody to take their meds?
They can, yes, definitely
it's
remind.
time to do that.
Yes.
So they're just not touching the medicine.
Correct.
Okay.
And you can send, a lot of times a private home care company might have a nurse that comes in once a week and sets up the medications. Or if there's a family member involved and they set up the medications, then the caregiver could say, okay, we're going to go to our pill box. We're going to open the Monday box, take those medications. So kind of walk them through that process.
I know that often bathing, showering, toileting, or cleaning up after toileting is something that a lot of family members start to go, for dignity's sake, for all of us, that's maybe not something that we want to do. Is that something that a private care person can help?
Absolutely. Yes. They provide that hands-on support with that, what they call either IADLs or ADLs, activities of daily living. So, and, everyone's different. Some people only want their family to take care of them because it is, for dignity reasons. Others wouldn't want their family in the same room during those intimate moments. So it's really up to, that individual and to the caregiver too. You kind of reach that point where you don't want your time spent with your loved one doing those task-based services and support. You want the time to be having a conversation or doing an activity, reminiscing, something like that, and leaving the kind of dirty work, so to speak, to the professionals.
That makes perfect sense. I get that so much with my family because there's just some things that I am not equipped for.
Absolutely.
Definitely. And a lot of this stuff we're talking about is really personal, sort of intimate things. So what can we be thinking about as far as making sure that the person that comes into our home to care for our loved one is trustworthy and we're using a trustworthy company? What's the best way to make sure of that?
Yeah. I mean, I think in this case, Google can be your friend. So Google reviews, I think really just do these companies have a social media presence? Go on there. What comments are being left? I also think with that being said, we all have to take everything with a grain of salt. People tend to leave the negative review and maybe not always share the positive. So just to keep that in mind. Also, Medicare.gov. You can go to Medicare.gov, and if there's a Medicare provider, they'll rate these organizations. So obviously that's a very reputable source to go to online. And I mean, I'm a big proponent of word of mouth, asking around, who do you know and what have you heard? And most of these companies too will let you come in and, interview them, so to speak, or provide an informational visit. Those are typically free of charge. And I don't know, I'm a feeler. How does that interaction go? That's a representation of that company. Do you trust that person? Are they following up with what they say they're going to follow up with after that conversation? And then also knowing too, sometimes it just comes down to a personality pairing. So maybe you get someone in your home and it's not going well for whatever reason. Most of those companies have other caregivers. And so just not being hesitant to speak up and ask for maybe a different person. We're not all a perfect match, and that's okay.
I know we had to go through a couple people with my uncle because he's quite particular and he's quiet and, just trying to make sure that the right person who could help draw him out.
Right.
Because that was, one of the big things that we saw is he was just sitting by himself all day and he wanted to be in his home. But at some point, the social isolation is a real problem. So having somebody that he could connect with was really important too.
Yeah, absolutely. And some people need some tough love. Some,
Yeah.
I mean, people need different things, and some people are able to provide those better than others.
Yeah, absolutely. So the one thing that we've learned while doing this podcast and working at Voice is that, pricing for everything is all over the place. So we know you can't give us exact dollar amounts for what anything would cost, but how can our listeners be kind of financially prepped for these conversations? How much should maybe an hour of care from, a private duty caregiver cost, ballpark? And are there programs that can help with the costs?
Sure. I would say, generally speaking, if you're looking for private duty, I would say average is about $35 an hour. Obviously, that's going to range from the company. Some of them charge more for different levels of care and different support, so there could be additional fees if there's higher care needs. But on average, that's about what you're looking at. It's important to know a lot of them have minimum hour requirements too, so it could be 4 hours a week, it could be 12 hours a week. It just kind of depends on the company. And that pricing is really the $35 an hour is based on most companies a 4-hour shift.
Okay.
So there are some shifts that are offered through companies that are shorter shifts, but then your price increases from there. As far as funding, it kind of depends on the company, but private pay, of course. Long-term care insurance, a lot of people don't know that they have a long-term care insurance policy that also does cover home care. So making sure that you're tapping into that benefit if you have that. VA benefits, some companies accept Medicaid as well. So it's just a matter of if they're approved provider. And then most recently, Medicare is coming out with a guide program, the guide model program. And so they are starting to support some respite care hours as well for patients that have cognitive deficits. Okay. So that's something kind of new coming down the pike. I'm sure we'll all start hearing a lot more about it too.
Awesome.
Yeah, that's great.
So we know that you've worked kind of in and out of this field, and you've worked in elder care for a good part of your career. Can you tell us some stories? Tell us some of your favorite stories that have come out of that.
Oh, Oh my. I mean, I'm sure all of us that have worked in healthcare, we could write a book, right?
We sure could.
And it would probably be a bestseller and
Yeah.
very comical. I think my favorite stories are, I'm a very lighthearted person. I think that with what I've experienced in working with this population, it can feel kind of grim and dim. I'm a big person that laughter is the best medicine. So some of my favorite moments are just the silly moments. I remember getting stuck in a skilled nursing facility and in a snowstorm and staying overnight. And I woke up and I had fallen asleep unbeknownst to me, and my head was on this poor little woman's shoulder in memory care, and she was like patting my head, and it was the sweetest moment. Those are the things I remember. And I think that there's just so much good that can be done in this space if you just connect with people, from the heart. But yeah, that's just, I don't know, that's one of my favorite stories because, I'm sitting there working in this space, like trying to be taking care of her, and she was, taking care of me in that moment.
Yeah.
But
It is kind of a nice circle. Is we're all really caring for each other at any given moment. And, sometimes you feel like the caregiver, but we're not always just the caregiver.
exactly. Those people are still in there too.
Yeah. It is amazing when you get those little glimpses. It's just like, oh, yeah, there you are. Love it.
Yeah.
Well, Vicki, I think those are all the big questions that we have for today. But I really appreciate you coming out and breaking down home care. I think it's one of those things that we all think, man, it would be so nice just to have somebody to come in and help me for a second. And it's so nice to know that there are organizations and companies out there that are providing this service. And that, it might not be cost prohibitive in every situation. So that's a really great thing.
Yeah, absolutely. Well, thanks so much for having me. I appreciate our time.
Yeah, thanks, Vicki. Did you like what you heard today? Do you have thoughts to share or insight on this topic? We'd love to hear it. Visit voicestl.org/podcast and click the survey link to give your feedback.